afternoon. We haven't quite cracked over into evening yet, but I just want to say good afternoon. And you are watching. If you've been watching today, you're like, wow, they're doing a lot of Facebook Lives. Well, yes, it is our Women's Health Summit. And so, as we did back in January, we did our State of Black Health, which is a wonderful event. Chronicling all the kind of major issues that are impacting African Americans disproportionately. And then in March, we did our Minority Health Month at the end of the month. And so that was 5 panels back to back of just about health and minority health. And we did a wonderful, we even did a bilingual panel, if you can imagine that. We did it. We had a translator in Spanish, and Dr. Renee can tell you about the challenges that we had with that. And I'll tell you something about that offline. So this month, as we know, May is the month that contains Mother's Day. And there is a Women's Health Week that is the week after Mother's Day. But we just said, why does it have to be a week, right? We've got all these other months, and then we're going to have Women's Health Week. So we said, no, we're going to make a Women's Health Month, and we're going to do a Women's Health Summit. And so everything you see today, I think I'm the first male to have appeared on one of the panels at this point in time, which is great, because that's what we're looking for, because today it's all about celebrating women and really about women's health. And so we had a wonderful, Dr. Renee did a wonderful interview with Ray Lewis Thornton. Let me tell you something. She is full of life. I promise you. So if you have not, please go back and watch that. Not right now, but please go back and watch that interview. It is fantastic. And she gives some great information. And she tells her story about HIV. She's very open and honest and transparent about her history. It's about overcoming trauma and the trauma that she endured, which led to some behaviors and led to her basically catching HIV. And now she's becoming a wonderful advocate. She's got a great book out now called Unprotected. So please, please, please go get the book, watch the interview. It was fantastic. Dr. Renee, you did a fantastic job. And I just got off with Just for Girlfriends. If y'all don't know, Just for Girlfriends does first Tuesday of every month. They do a program here. And it's a wonderful organization based out of Chicago of women really just getting together. It's not a sorority. It's a women's organization that has they're just women that need to hang and have some girlfriends, and they have group chats and a lot of activities and membership. They've got a membership in a local membership in DC and Chicago, and they're going to have one in Atlanta coming soon. So we're just excited about that. And so they did a fabulous panel about self-care. It's a self-care is not selfish. And so I just can't explain how much they really talked about different things, the challenges that women face. And they shared some health challenges they had by not engaging in self-care. One lady had a heart attack and she didn't know it in the middle of the night. So she went back to sleep, then continued to have problems, drove herself to the hospital, right? And so because, the challenges that many times women are so, especially Black women, have this, the strong Black woman kind of narrative that out there. So don't ask for help. We just say, hey, we got to put our nose down, and it's a sign of weakness if you ask for help. No, asking for help is the strongest thing you can do, because it lets you, because that's what you need, and do some self-care and checkup. So that was the first 2 panels. Today, this panel is about staying connected to your pharmacist. And so we have a wonderful pharmacist who's going to be joining us a little bit later on the program. I see you, Dr. Shawna, so that is great. I'm glad you are here. And so we have a wonderful pharmacist that's going to give you some tips and about pharmacy. And really, we're going to be talking about it through the lens of COVID, right? And so I know we just had a wonderful conversation with Ray Lewis Thornton. We had this great conversation about self-care. Now we got to talk about COVID, but it's still around, right, Dr. Renee? It's still around. And I know mandates are going down and businesses are open back up and people are going to baseball games and concerts and parties and everything is hunky-dory.
Why you say all that down? The numbers are going back up.
Yeah, exactly. So we have to be cognizant. So and we have to be more diligent, because before, when the government was closing everything, right, when there was mandates about masks in the stores, it just pushed you in a space where you had to follow the rules. Now it's up to you. And I can tell you, when I go to the grocery store, I might be one of 4 people in there with a mask on outside of some of the people that work there.
I agree. I went to the UPS store today, and except for the workers, I was the only one in a mask. And
Right.
I wasn't the only one in line. There was other people in line.
It is, and that's the challenge, right? And so full on. So where are we? So here, let's, Dr. Renee, where are we in terms of COVID? What's the latest on COVID? And let's kind of get the people that are watching us. And if you're watching us, please let us know where you're watching from. We like to drop that in the comment section. We like to see where people are watching us from. If you have any questions, I know, especially for our guests later on, with our partnership with Walgreens, for our guests later on, just if you have any questions, please drop those in the comment section. I would say share this show, right? Because we got to stay up to date on where we are with the pandemic and everything that's going on there. And tag a friend. If you got somebody that needs to hear this information, you just have somebody that's on the fence, or you're vaccinated, they're not vaccinated, you need to help them. Say, hey, look, I got a show that you need to watch because they got some great situations going on. So, Dr. Renee, can you kind of give us an update of where we are with COVID?
So COVID is not left. We still have to deal with COVID. The biggest thing now, though, is that the numbers are going in the wrong direction. They're going up because we just came off of Mother's Day. And before that, we had Easter. And then I'm sure you all know this weekend is Memorial Day weekend.
Mhm.
So I know we want to gather, but let's gather outside because the numbers are going up. And the word on the street is that there will be yet another surge in the fall winter time. So it is really, really important that we do remember that thousands of people are still dying every day from COVID. So
Mhm.
it is very important that we wear our masks. I've traveled, I've flown, and I wear my mask. I wear my mask from the time that I get out of my car to the time that I get back in it to the next car when whatever's picking me up. I'll take my mask off outside, and then if I'm in an Uber Lyft, my mask is on again.
Mhm.
And then I'll take it off outside. But I'm not taking off my mask. I go to the grocery store. I have my mask on from the time I get out of my car till I get back outside. The only place that I will go without a mask is outside. And that's when we're not, packed like Wolverines together. And actually, I haven't attended any functions where we have been. I have all the functions I've attended, people are more than 6 feet away from me.
Right.
I walk outside daily now that the weather is good in the Midwest, and I don't need a mask because I'm walking outside by myself. There is nobody else walking with me. We don't have sidewalks, so therefore I'm not walking on a sidewalk, so it's not crowded sidewalk. It's just me. So, but we need to remember to please stay vigilant because people are still dying. And my biggest thing I said in the beginning of the pandemic, please remember that you might be healthy as a horse, but whomever you live with, care for, love very dearly may not be. So that's why you should wear a mask so that you don't get it and have zero symptoms, but that you give it to somebody else unknowingly and then they have a rough time with it. So, that's why it's so important. The other thing is, they have said those over 50 can
Mhm.
go get their boosters. And
Yeah.
yes, I mean another booster. Yes.
Right.
Over 50, you can go get another booster. Now, I'll tell you another secret though. They cannot ask you your age or the reason why you need a booster. So, needless to say, in the next week or so, I will be getting another booster as well because I am a caregiver. And since I have to take other people to get theirs, I might as well get mine as well. Not to mention, I do have severe asthma that I like to say is dormant, which is probably the allergist is like, what did she say? Exactly. I don't have to take daily medication. So I don't want to take daily medication. So I have not had COVID and don't plan to get it. Another thing I did notice, I was getting my nails done. I wear mask. We still have the plastic shield between us.
Mhm.
And my nails person wears a mask, and I also go when there's like barely anyone in the salon. But a lady came in and she was just going on and on about how she got COVID twice and how it's no big deal and she doesn't know why people are making it such a big deal. And for those that know me, I wear a mask that very, very nicely says, "Ask Dr. Renee." So when I stood up and turned around and she saw that, I saw her mouth drop open because I know she knew you're talking foolishness. Now, my name is not the police, so I am not going to sit there and I've told you I'm Black Doctor. Ellis has heard me say it. My job is not to convince you of anything. It's just to give you the information so that you can make a decision for you and your family.
Right.
So I was not about to sit there and tell her, ma'am, you're talking stupid, because I think she knew that much when she saw who I was. But please, please, God bless you if you get COVID and you do fine with it. I'm so happy for you. But please understand that that's not the case for everyone. I think that everyone by now knows somebody that's died of COVID. If it isn't somebody that you know personally, it's a famous person. So please, let's just not say anything stupid like that. The
Right.
other thing is, a lot of people, everyone's going to get it. I promise you that I will do everything in my power, and I'm doing pretty good. I will not get COVID. Okay. Because I just wear masks. I went to a funeral yesterday and I had a mask on the entire time, including the fact that I had to get on the microphone and read the obituary.
Oh
Still
wow.
didn't take it off.
Wow.
I'm an orator, so I really worked hard to make certain that I could be understood through my mask. Because actually, I had two masks on. I had a KN95 and then I had a cotton one over it. I'm not playing with y'all when I say I'm not getting sick. I just told you I'm a caregiver. If I get sick, who's going to take care of the real patients, right? And
Right.
who's going to take care of me?
Right.
So I'm not getting sick. So I literally, and my mom was there, and I said, Mom, you could understand what I said, right? She said, perfectly. I had the mic up to the, mask, and I projected and made sure, I opened my mouth and I spoke very clearly, and everyone heard everything I said. But I just know for me, it's just I can't play with COVID.
Right.
We've had people that I've actually interviewed here on the show that have been healthy as a horse. Derek Blanks, if anyone knows the famous photographer Derek Blanks out of Atlanta, he came on and talked about how he was hospitalized with COVID. That man, if you've seen his pictures, is in far better shape than myself. And if it could knock him down like that, then I was like, I'm good. And then we had Dr. Francine Pierce. Dr. Fran said that she was so out of it, her family would knock on the door just to make sure she was alive because she was sleeping for like 14, 16 hours a day.
Right.
Dr. Fran is, the woman, you'd never know her age, and she's got college age children. She looked like the picture of health. But I was like, if it knocked her on her back like that. So yes, I'm vaccinated, but I also am one person that understands that vaccine does not mean can't get COVID. It means that I will not get as sick as I could have if I wasn't vaccinated.
Could you say that again for the people in the back? Because I think really earlier on in the pandemic, that messaging was missed.
Yes.
And people heard vaccine and equated that to immunity, right? And they drew a line that didn't even exist, but they drew that line. Once I get vaccinated, I should be immune. And so when people were still catching COVID, they're like, oh, it doesn't work. No, it works because they kept them out of the hospital and it kept them from dying. And that's what the vaccines were designed to do. So they are working, even with the new variants. And so if you're just joining us, we're talking this third panel. We're here at Women's Health Summit. This is the third panel of a 6-panel. We got 6 panels today about women's health. And so this one is about COVID because that affects men and women. But as we know, women tend to be the chief medical officers of their family. As Dr. Renee talked about, she's a caregiver herself. And so we included this panel with our friends at Walgreens because we really want to kind of talk about, hey, give you some updates. We crossed a milestone recently. We crossed over 1 million people.
1 million deaths
in this country from COVID or COVID-related symptoms. Number 2, we just had another breakthrough that was announced recently that I think children 5 to 11 can now get a booster shot. Is that that's correct? Right. And so they just the FDA or CDC or one of those letter organizations that said women that children can now get boosters. And so that's some new information that is coming out.
And they also announced yesterday, June, July, they're thinking that under 5 will finally be able to get vaccinated.
Absolutely. And we're going to ask our pharmacy guest, Dr. Shauna, when she comes on, and we're going to talk about, because I think people right now, when they say, oh, it's vaccinated, you've been very comfortable getting vaccinated, right? Children to the age of like 18 get like 16 different vaccines in their early
life. If you travel internationally, then you really okay with getting vaccines because, you cannot step on the foot of the continent of Africa without getting something.
Yes, multiple vaccines. And
Yeah,
so I would say that the politicization, I say that 5 times real fast,
right.
this particular vaccine has made it such that it has somehow become controversial and seen as something separate than the many other vaccines that we have to take. I guarantee you, step on a nail, and see if you don't get that tetanus shot, right?
Exactly.
I double dog dare you to do that. It's going to happen. You're going to get that tetanus shot.
Right.
And you've had it, right? And you've had it before. But if you step on something
And
metal,
people who work in hospitals, you have to have vaccines to
yep,
work in the hospital usually. Because that's what
you
I
got to do
that's
that
when I
TB
had to get
test.
all of my boosters again
Yep.
because I was, going to work in the hospitals as a med student. Kimberly said I could have had it, but I didn't have symptoms. No, I couldn't have had it because remember I said I was a caregiver, so we have a lot of testing going on. So that's how I know I don't have it. Yeah. So
And real quick before we bring on our guest, because we really want to talk to her about what's going on in the pharmacy, because healthcare is really a three-prong. And too often we look at it as a two-prong thing where it's just the patient and their healthcare provider. But the pharmacist plays a crucial role in that healthcare triangle. And if we're not really listening to what the pharmacist is telling us, the things that the doctor is trying to give us and get us to take, if we're not doing it, we're not listening to what the pharmacist is telling us, it's not going to work as effectively as the doctor wants it to, right? So we have to make sure that we're ensuring and we're listening to the experiences of what's happening in the pharmacy. So we're
right.
really going to get that today. But I will say that one of the things we have to recognize, right, when we're talking about the coronavirus is a virus of community. It's not a virus of the individual. And what do I mean by that? What I mean by that is that somebody could have COVID and not be vaccinated and experience it just fine. Oh, it wasn't that bad. It wasn't that bad. And what Dr. Renee was talking about was that person extrapolated their personal experience to how everybody else is going to experience the virus. That's not the way this virus works.
Nope.
It impacts everyone differently. And if you are, let's say, like you're pre-diabetic, it could push you over into being diabetic. You may not be diabetic at all, or even pre-diabetic.
Well,
People have
there's a long haul symptoms
this
symptoms
long
that is
host of
actually giving people diabetes.
it's giving people diabetes, and hypertension and erectile dysfunction. There's been a number of ailments that have been associated with long haul disease, and that's the people that survived it, right? And so, why would you want to put yourself in that position when there have been some really, really phenomenally developed vaccines that are available to you, and they're getting
95% effective.
better.
This is the
And
first
they're getting
time ever
better.
that a vaccine has come out is 95% effective.
Absolutely. And so, why would you want to put yourself in a situation where you don't have the most effective treatments available to you? It doesn't make any sense. But that's where we are. So, it is again. It's a virus of community. So we're going to bring in our community pharmacists here. And so, Dr. Shada, yes, we can see you. Can we hear you?
Hi, can you hear me as well?
Yes.
Yes, we can.
Awesome. Hi, thank you for having me. I was just listening and such entertaining conversation. And Dr. Renee, I relate to everything that you said. I haven't had COVID, don't want it. And I still wear my mask. So it was refreshing to hear you talk about that. I was just laughing backstage because I was relating to everything that you had to say.
And if y'all didn't know, like Dr. Renee went viral very early in the pandemic. She did a video for us on blackdoctor.org that you had like, at one point you had like 5 to 7 million
Oh,
people.
I forgot about that. You're
You
right. I
remember that video?
completely forgot about that.
Yes. Yeah. So
Talking about the vaccine.
talking about the vaccine, and the video wasn't much longer than a minute and a half, but since we were so early in that, and it was just so real that it took off. It was incredible. So we were really excited to have that, because I think that really helped in us becoming an integral part of getting many people vaccinated. So, Dr. Shauna, I guess you were listening backstage. I saw you shaking your head and smiling. I was like, yeah, okay. So she's feeling what we're saying. So I guess my first question for you is this: that the pandemic has highlighted some of the challenges experienced by healthcare workers. What are some of the challenges you experienced or encountered as a pharmacist?
Oh, first off, I have to say, when we look back, it's been 2 years. I remember when they first issued those self shelter in place orders. And we really have made tremendous progress when you think about development and vaccine administration and testing, and even now we have treatment. But I can never forget when we got the call to action to administer the vaccine in the long-term care facility. It was a quick call to action. We had to get teams together to go into the long-term care facilities to take care of our most vulnerable. And it was not easy. At that time, we still had fears of what would happen. And we had to, the storage, that was the biggest challenge. The storage requirements for the vaccine, being able to mobilize and carry the vaccine to the long-term care facility and ensure that we were delivering that vaccine with the utmost care and quality. That was the biggest challenge initially. And then dispelling the myths. So we had various clinics. We had the mass clinics that we organized, especially here in Georgia, and dispelling the myths, so encouraging our Black communities to get vaccinated. I remember I was sitting at a mass clinic at St. Philip AME Church, and we had one African American female sitting in the chair, and she was crying. So I was overseeing the clinic, and I walked up to her just to have a conversation, and I asked her what was happening, and she said, "I'm here in the chair. I want to get the vaccine. I know I need to get it, but I'm just scared." So and one of the reasons why she was scared is because of the speed at which the vaccine came to market. So I sat there and I spoke to her about 15 minutes explaining why the vaccine was able to come together. Everybody worked together across countries to get this vaccine, governmental agencies, drug companies, and that was the reason. They did not skip the safety and efficacy steps, right? So I actually sat there, spoke to her about 15 minutes, held her hand while she got a vaccine, and then that moment I realized, as a pharmacist, having to have can have that conversation in the moment, provide the vaccine. That was one more person that we were able to protect. And I have another story. I remember we were at that clinic because the conversation was it access to our Black communities, or was it hesitance? And I can tell you, I questioned that day, because we had people lined up around the church down the road to get a vaccine. And at that point, I realized it wasn't so much the hesitancy that played a part, but it was access. So we were
Hmm.
bringing the vaccine to the communities in a church where they trusted. So, and we were able to do the vaccine. So I sat there and I spoke. After the vaccine, you have to wait for about 15 minutes to ensure that, there's no issues, no side effects. So I made it a point of duty to stay in that area and observe patients and talk to them. So I was talking to this one gentleman and I said, "Did you have any hesitancy in getting the vaccine?" And he said, "I wasn't going to get it." And I said, "But you're here. You just got it." He said, "I promised my sister on her deathbed that I was going to get it. She was dying from COVID, and that was his last promise." So he drove 4 hours away from Savannah, Georgia to that church just to get a vaccine to honor his sister. And these are the kind of stories, multiple stories like this, that we heard of. So we're able to get a lot of people vaccinated. Then fast forward that to the booster shots availability. You see the decrease in the spread, and the waves up and down. And then the testing. Now we are able to provide testing in our stores. So we've come a really long way. And then treatment. So we have antivirals to prevent, those severe illnesses, and we're able to provide that. So we can test. There's some locations we have providers on hand, so we can test, provide results, and they get treated, and we provide the drugs. So a lot of things that have happened over the years. And as a pharmacist, I'm super proud that we were part of that. And looking back, where we came from to where we are, we have a lot to be proud of, especially now with the boosters that are in. But yes, as Dr. Nate, I'm confirmed, we have some cases. So that's where we have to continue the education about how to decrease the community spread. And it's all hands on deck. Everybody got to be a part of it.
Definitely. And Walgreens is they have drive-through testing
Mm-hmm.
that is
Yep.
so convenient. And all you have to do is make your appointment. Same thing for your boosters and your vaccine. You make an appointment on their app. It is so convenient. I only know this because I just made appointments. And so
Good job.
So, yeah, and actually Walgreens is where I received my booster.
Mhm.
So yeah, and so that's in actually our household. That's when we went to Walgreens, and it is so convenient. You put in your information. You all do not have to pay for these boosters. You do not have to pay for these tests. They ask for your insurance information because the insurance will cover it if you have insurance. But if you do not have insurance, they're not going to say you cannot come. So please, it's so easy. Everyone has a mobile device these days. Go download the Walgreens app, make your appointment, and just take care of yourself and your family. Because, of course, we do know that our elderly population may not be able to be as savvy with the app, but you can sit there and you can make their appointments too. So please, please, come on, let's help each other out, because your elderly population are the ones that need to go back for the second booster. Now, whether you get it or not is up to you, but they need to definitely go back and get their fourth shot.
Preach it, preach it, preach it.
So,
I
so,
love it.
so,
I can listen to you all day.
so, Dr. Sean, let me ask you a question. So, I hear you talk about making appointments, and it is very easy to make an appointment through the app. So, I'm encouraging y'all. I'm just speaking from personal experience. Download the app, make your appointment. But can people do walk-ins as well? Because sometimes people make those,
Absolutely.
and if we just see a Walgreens and you know what, it's time for my booster. Can I just walk in and get a booster?
Yeah. So we encourage the appointments, but definitely the goal is to provide a shot. So if you're presenting to us, we seize that opportunity, right? We would love for you to make an appointment. It's easy, as Dr. Renee said. Love that you have that experience. You can download the Walgreens app. Also Walgreens.com. Schedule a vaccine. They just require you to enter your date of birth, the manufacturer, and the last date of your vaccine. It's as easy as that. So and especially with the testing too. So the combination, you want to test if you're going to attend any parties where you may have a combination of people who are unvaccinated and vaccinated. When you may be around somebody who's immunocompromised, have certain diseases or disease states or conditions that make them vulnerable to certain infections. And you want to ensure that you are protecting yourself as well as others. And you contribute to the decrease of the spread of the vaccine. That's the ultimate goal. I remember you said, Ellis, it's not just individual. It's a community disease. So we
Right.
all got to do our part. So we want to get boosted. We want to get vaccinated, boosted, and tested.
Absolutely, absolutely. So y'all are also giving vaccines for children?
Absolutely. And just as you mentioned before, from ages 5 to 11, the most amazing news were just approved for boosters. And it's important because studies have shown that in that population, when they vaccinate, they're better protected against the variants like the Omicron variant. And we know kids, they can spread this, and it, expanded to this particular population is going to further support the decrease in the community spread. So it's absolutely amazing news. And as you said before, we vaccinate our kids. It's just like any other routine vaccination. It's
Right.
important that they're fully vaccinated and boosted.
So here's the question that I thought of, because as Dr. Renee mentioned in our opening, that the cases are going up. There's been some bumps in the cases. Now I'm in and around of that age that I should be getting another booster. um, should I wait? Because we know the fall is always that time where we tend to see the cases really go up. That kind of late summer, early fall, we start seeing some tick ups, and then as it starts getting cooler, it kind of follows that pattern of the flu. So should I wait until that time, or should I just go ahead and get boosted now?
So you want to go ahead and get boosted. The CDC is really encouraging that because the cases are rising. So eligible patients our customers, patients should get boosted because, as I said before, it's going to contribute to that community spread. People are still dying, as Dr. Renee said. They're still being hospitalized for COVID. Different people have different experiences, especially when we have our African American population that's the most vulnerable, people who have diabetes, hypertension. So we don't want to wait. So you may contract COVID and you have no symptoms, but you can pass it to that other person that may end up in a hospital. So it's our individual responsibility as well responsibility to the community that you serve and you live in, that you get vaccinated and boosted.
So y'all heard that? No more, no delays. Don't try to delay it, because in that delay, you might catch COVID, right? You might your antibodies level might drop, because that's why we're getting boosted, is to keep our antibodies levels above a certain point. So in that time that you want to wait till it's more, you think it's going to be better, and you need to get boosted around this time, you could catch COVID, right? And then that could be more problematic. So if somebody's had COVID, could they still get vaccinated?
Absolutely. Yes. So there's a waiting period for that. So if you're symptomatic, you want to wait until the symptoms are resolved, and you have that 14-day waiting period before you get vaccinated. But you want to still, because you can still get the benefit from the vaccine, where you can contract COVID again, as Dr. Renee said, but you can decrease the severity of it by ensuring that you are vaccinated, and you have your not immunity, but you're protected against severe illness and hospitalization if you are vaccinated. And for those who are hesitant out there, I can tell you, I'm a pharmacist. I'm married with 3 kids. My husband was very hesitant, and I can't tell you how embarrassing that was, being a healthcare professional. And my husband looked at me and said, "Absolutely not. I'm not getting vaccinated, and you're not vaccinating my children." So
Wow.
that was the conversation, because he was so hesitant about it. And then, so I was vaccinated early on, December 28th, when the vaccine came out, because when we went into the healthcare, we're healthcare providers, so we were able to get vaccinated. We were providing it to the long-term care facilities. Yep. So what happened right around March, my husband contracted COVID. He wasn't eligible then, but he had the worst time. Right after he recovered, it was 2 weeks. He was really sick, fever every day. There were a couple of times that I thought this was it. We're going to have to take him to the hospital. But he made it. Right after, he said, "When can I get my shot?" And when can we get the kids vaccinated?
Right, because he didn't want them to go through
horrible experience.
Right. And that's interesting. You're bringing up an interesting point, because you can have houses divided, right?
Right.
It's like you're a healthcare professional, and you're like, I'm getting the best data from multiple sources that are saying, "Hey, this vaccine is safe," and your husband was like, "Nah, I'm not." Don't even play.
Yeah, he reminds me about the boosters. When are we getting boosted? Because it was such, it's that, benefit versus risk, right? So he doesn't want to risk getting COVID again. And I haven't contracted COVID. So I'm with you, Dr. Renee. I am an example too. You boosted, vaccinated, and a healthcare professional, attended many clinics. I never contracted COVID. Not to say that I couldn't, but it says something about vaccination.
Yes, and wearing your mask.
There you go.
Folks, at the airport, I have 3 masks on.
Oh, wow.
I'm just not. I don't know these people. We are in the plane, and I don't drink. I don't eat in the plane. I literally do not remove the mask until I am outside.
Yeah,
I understand.
And
I go into
it has
the plane,
worked.
and I see it's uncomfortable not having my mask on if I'm on the plane and so forth, because you think about that. And knock on wood, I used to get sick a lot from wearing the mask. I find that I'm not.
That's why everyone's like, "Oh, we haven't had." I'm like, that's because you're wearing a mask.
Yeah.
No germs can pass.
The flu seasons of the past 2 years have been really, really low, but that doesn't mean you don't go get your vaccines, right? And so, and I'm hoping. So Dr. Marks, this is something that I need to know. Are they going to? You think they'll come out with like a combo vaccine where I could get COVID and the flu shot in the same one? Like, are we hoping that we could get to that level where I can get one shot?
I'm hoping so.
I'm needle phobic. I'm definitely like needle phobic.
Most men are.
I cannot look
my
at.
dad is awful. We're like, "Dad, that was a little needle, Daddy."
Yeah, I can't like.
It's a good thing they don't give birth, right, Dr. Mark?
Exactly. So you know what? I can take care of you. I can give you a shot and you don't even realize it. I'll throw at it. So I've done it so many times with needle phobic people. I have your conversation before you know it, you're vaccinated.
That's a good person. Yeah, because I've seen people like working with children, particularly, who do it so well. that the child doesn't even realize they got shot. Like, what?
Mm-hmm.
It's over?
And also we worked with adults that were disabled, that population of patients. And that was a hard population, right? Because they have certain needs and you have to ensure that they're comfortable and in a space. That was the most difficult for us when we were giving the vaccination, ensuring that they were comfortable and very challenging. And it took multiple people to do it. So we were able to really support, with that population of patients to get them vaccinated. And we learned a lot of lessons from that. So I'm even more of a pro because of that. So I got you, Ellis.
Well, I'm coming to your Walgreens to get that next one, because I promise you, it was like, and I would feel that anxiety, right? But my desire to stay safe and stay healthy overrode that anxiety. But even it doesn't matter. Like I can't see myself get when they take blood from when I go to my physical, I have to turn my head, and she's like, "Sir, why are you're so nervous?" I'm like, I just don't like it. And I told them, insurance physical, they had to take some blood. I was like, "You got a butterfly?" I made her go back out to get a butter. Yes, I'm not playing
I
with
have
you.
small veins, so usually they have to use a butterfly because I have small veins. But I spent so much time as a sick child that needles don't bother me. As a
She was
matter of fact,
impressed that I knew what a
you give
butterfly
me some
was.
liquid medicine, I'm gonna be like, please. I like as a child even, I was like, I'll take a shot. I don't want that liquid medicine. They're like, what? I was like, yeah, just is it an IV you can give me? Because I'll take that. They're like, what's wrong with this child? I'm like, I just would prefer. It's not that big of a deal. And when they, as a child, they're like, you need to look away, and I'm like, no, I need to pay attention, and you know what you're doing. They were like, who is this kid? My mother's like, she's somebody who spends a lot of time in the hospital. She knows how it's supposed to go, and she's gonna watch and make sure that. And I told you I have small veins, so people have to go like three times sometimes.
Okay.
I'm like, I only got two arms. Like, what are we doing? Get it together. But
And
yeah,
that's why you're Dr. Renee right now,
right.
because you paid attention to what was going on with the rest of us. So, Dr. Marks Wilson, you mentioned earlier, you were talking about how Walgreens really went into the community. I think when we're talking about getting vaccinated, because the unfortunate reality with the numbers is that African Americans are still lagging behind in terms of overall vaccinations. However, we are well in front when it comes to COVID cases, deaths, and hospitalizations. How do we close that gap? And the way we got to close that gap is that there is a well-earned distrust of healthcare and the healthcare community by Black people. We understand that we don't have enough time to go through that history. But what we're saying is what you were speaking about with what Walgreens did. They recognized that and said, you know what, we can't sit here in our pharmacies and wait for people to come. We've got to go out and engage with the community to show them they're safe, to show them we care about their safety. And I think that has gone a long way in terms of getting people excited. I'm not even excited. Nobody's excited about getting vaccinated, but getting people more vaccinated than they would have if they just sat back and waited for people to come in and make appointments.
Yeah, and definitely. So we have a long history of doing that. It didn't start with COVID way back with the flu shots, bringing the vaccine to the patients in there and the people in the community, partnering with the trusted organizations. So the sororities, fraternities, organizations like 100 Black women, 100 Black men of America, National Coalition of 100 Black women, partnering with them to bring the vaccines to community, with the churches, the trusted organization and community centers. So we, as I said before, we had many clinics at churches. St. Philip AME was one big one in Georgia that we did, where we're able to vaccinate 7,500 people,
Wow.
over 3,500 over a long weekend, and over a course of a couple of months, 7,500,
Wow.
and that's in the underserved, medical and underserved community, that we were able to do that. African American community, bring the vaccine to them, right? So really bringing the vaccine. We also have mobile bus stores around the United States, parking in front of, the Black universities, really going around and bringing the underserved communities where we have a lot of vaccine hesitancy, with the mobile bus going from state to state, trying to get to each and every population. So it's getting everybody vaccinated one shot at a time, so nobody left behind. And that's what we're looking at. We continue, so we still know there's a need. We're still in the community, and also we have that bandwidth of our stores to be able to make the vaccine accessible. Not only that, our pharmacies are trusted, leaders in the community, and we're accessible, and we also represent and in the community that we serve. So if we're our pharmacies are culturally diverse and definitely the representation of the community. So it makes our our patients really much more comfortable. Our pharmacists are approachable, very well knowledgeable in everything vaccine and in health, right? So, and very much accessible. And then, the COVID has really highlighted that, the need to that our pharmacists, the skills that our pharmacists have, and the ability to provide these healthcare to the communities that they serve. So I'm happy about that. You know everyone realizes that we are able to care for our communities in at a higher level.
Absolutely, absolutely. Dr. Renee, so, all right, so we've got people don't get their boosters. There's also another thing, and I learned this recently,
Mhm.
is that insurance right now is mandated to pay for home testing kits, right? So if you go into your local Walgreens and you buy your home testing kits, you take your receipt, you send it to your insurance company, and they will give you 100% reimbursement. You can get more tests from the government by going to their website. You can get masks, the N95 and the KN95 mask. There are many ways. So they're removing all the excuses because we
Mhm.
understand that a pandemic has to be quelled by the people. It cannot be quelled by like the government say, okay, we've got these materials, so we're going to remove the resources. That's how we were able to get a vaccine so fast. They said, okay, we know, as you were saying earlier, Dr. Ray, it normally they've got to go find the money and then do the research with the money that they find in order to create a vaccine. The government said, you know what? No, here's the money, create the vaccines, right? And we'll buy whatever you create. So they took that off the table. They're taking it off the table in terms of cost, prohibitive to get your. Just go in there, go in your local Walgreens while you're getting your snacks and your drinks and whatever. Get you a testing kit, right? Because that is the first line. So as soon as if you have been exposed, you can swab yourself to get a check. If you start having some similar symptoms, swab yourself, get checked, and then if it's inconclusive, go in. So there's no reason for you not to
Mhm.
get
And
checked.
most
And
importantly, with Memorial Day weekend coming up, you need to have tests at your house. If this is what you deciding to have the Memorial Day weekend dinner inside your house, because really, if you do it outside, you're a lot safer than doing it inside. But if you're going to be inside, then you need to make sure the people that come in your door test before they come in your door.
And I'll make it even easier for you. So you said they can pay for it and get reimbursed.
Mm.
It's gotten even easier. Many insurances will allow you to go to the pharmacy, and the pharmacist can process.
Oh,
Um,
wow.
yes. Say we can process for you at no cost. Many insurances are allowing that. You can get 8 kits per month. So I encourage you, each and every one of you, to go to your local Walgreens, and you don't need a prescription. We take care of that, and we can process and give you 8 kits per month. So each family member. So, and you don't have to pay up front. If your insurance covers it, which a lot of the insurances are, we'll
Right.
process that for you, and you can get the kits. If you fill your prescription at Walgreens, you call in your prescription, you use their mobile app, or you speak to someone in the pharmacy, just let them know that go ahead and process my kits. I'm on my way to pick it up.
Well, who knew?
That's amazing. Like I'm like, okay, I thought I was gonna have to go to because all right. So I'm gonna let
Yeah.
y'all behind the curtain a little bit. Yeah, I typically don't send in reimbursements.
Right.
Just
It depends on how much it's for, right?
like I don't like even when you buy the something that's got the little card on the top, you say send us in and you get $2. I'm not gonna do all that. But if I could go get into the store and get it processed right away, oh yeah.
Yeah. Yeah. And zero cost. Most insurances, quite a few insurances are covering it. So ask, and there goes your kids from Memorial Day weekend, right?
Exactly.
So, mhm.
Yes, and this is a heavily, heavily, heavily travel weekend. This is one of the biggest travel weekends of the year. Is Memorial Day weekend.
They said Thursday and Friday are going to be crazy at the airport.
It's
Yes.
typically it's touted as the opening of summer, right? Even though we know summer doesn't really officially start till like June. We're still in
Hmm.
spring, but Memorial Day is always kind of seen as that symbolic kickoff of summer. So it's going to be a
Mhm.
whole lot of travel. I would say if you are vaccinated and have not been boosted yet, go into your local Walgreens. I'm sure there's one there near you, and get your booster shot. Yes,
Yep.
we understand it's going to take a while for peace of mind is worth a lot, right? Peace of mind is worth a lot. If you have not been vaccinated, go get this. Go. This is an opportunity, right? If you're planning to do any travel, man, the airports are wide open now. It's a wild, wild west. People are not wearing masks.
Yes.
Like it's really, it's really, a challenge, and I say that in jest, but it's really been a challenge um, in order to stay safe. And you have to be more diligent. You have to be more personally diligent to stay safe because a lot of the mandates have been lifted and rescinded.
And even though they've been lifted, there are some people that still do follow, and you should not bother people that have their masks on and not ask them why they're wearing a mask. Or don't say, you don't have to wear a mask. I have seen way too many of my friends that have taken Ubers, and the Uber driver's like, oh, you don't need to wear a mask. Don't worry about what I got going over here.
Your job is to drive that car. How about that? That's it.
Right. That's all. You keep your face turned that way. Let me handle mine. Okay.
So we got a question, and Lisa, thank you for the question. She's saying so you can pick up free COVID test kits from Walgreens up to 8 per month. It's
Check
not
with your
that.
insurance is what she said. Check with your
Yeah,
insurance. Your
yes,
insurance should cover it.
yes.
So
Yes.
you call the Walgreens, and then they can run your insurance for you and check, or you can call your insurance company and say, hey, do you cover
Mhm.
COVID tests from test kits from Walgreens?
Yes.
Mhm.
So in a perfect world, yes. But just make sure that your insurance is going to cover it at 100%. So you don't go in, but yes. So just call your insurance. Say, hey, are y'all covering 100%? And then you could go in and show it, and
Mhm.
maybe check with the store too to see if they can process your
Right.
insurance when you go into the store because there might be some procedural issues that will take care of that. But for the most part, most insurance are covering it at 100%.
And then the other thing, Ellis mentioned, you can go back to the government because the government gave, I think, 4 per household. You can go back to them and get more now. So
Yes. Yes,
Mhm.
they authorize more testing kits to be sent home, so you can have them sent directly to you. And the site is escaping me, but
yeah, I don't remember it.
it's really really simple. All you have to do is go to Dr. Google and just put in free COVID test, and then
Government.
government, and then it'll pull up the site. You just go directly to the site, put your information in, so you can get 4 more for your family, and then the rest of them you can get insurance. We had a doctor out here that works on Biden's team, and he said every time he goes into a drugstore, he just grabs for a test, and he even showed his check that he got back from his insurance company. He had a check right there and say, "I got this nice check." He said every time I get it, I send my receipt in and I get my nice check. And he keeps tests in his house because he's not only just for his family. The reason why you're buying it. So he said, why, if I'm getting tests free from the government, why am I buying it? Well, you're buying them because you might have friends that come over. You might want to test them. If you have family members that want to come and visit, if you want to spend that family time, it would be nice if when they got there, you could give them a quick swab, a quick test, just to make sure because we know that you don't show symptoms for a few days, but you can still be contagious. And so you can give a quick swab and get that peace of mind. And really, this is really about, again, as we said at the beginning, this is about community, right? And how we're going to have to interact with each other differently until we get into some sense of the word I learned was endemic. um,
Yes.
we got to get to endemic status. And until then, we're going to have to treat each other differently. Now, Dr. Nay is tripling up the mask. I don't know about triple mask. I don't know. I don't know if I would triple them up, but I am
Well,
going to.
I have a plastic shield, and then I have the KN95 and the cotton one over that.
Oh,
I,
wow.
I,
It's
You're
rough
well
when you go to
protected.
TSA. It's like, He's like, I have to. I'm like, okay, just a minute.
That's right, because you got to see the pitch. You got to match the face with the idea. It's like, I got to wait. You should turn around to people behind. It's going to be a minute. And just
Well,
just
I love that Apple has changed my Face ID, so now they have
Right.
where I can still wear my mask and I can
yes.
open my phone. I was like, okay, Apple, I just love you again.
I thought it
Well,
was a pretty cool feature when I heard about it.
Right?
That's pretty
And
amazing.
it never, like, I had not tried to set it up. So when I finally set it up and I saw it worked, I was like, oh my God, this is amazing. Yeah.
yeah. So as we're wrapping up here with Dr. Shauna Marks Wilson, she is a pharmacist. And she is working with Walgreens and a great partnership with Walgreens to get more information out. So I know, yes, this is Women's Health Summit, and we've got some great women's health issues coming behind this. We're going to be talking about fibroids, and right after this, we're going to be talking about breast cancer and clinical trials, and then we're going to be talking about keeping your skin healthy and your skin and hair healthy. So we've got some great panels for you women. So just stay with us. But right now, we're talking about staying safe through COVID, right? And so we've got to deal with the elephant in the room. It's still around, even though I know we're trying to move past it mentally. It's still around, and so we've got to protect ourselves. And so we're here talking to a pharmacist, and with our partnership with Walgreens, just to kind of give you what's the latest. We gave you the earlier numbers, and right now we're talking about things that you can do that's very convenient. So I would say, one, download that Walgreens app. If you've got a Walgreens in your area, you can set your appointment in the app. That'll be perfect. That'll make it easy. Set your appointment, but they also take walk-ins. Now, come on. Set your appointment, keep your appointment time. But if you got to walk in, we'd rather have you there. And Dr. Park's like, look, if you come as you are, we take you. Look, we go give it to you, so you can do walk-ins. Booster shots are available for kids. Don't delay. Don't wait till, we're gonna wait till it's about time to go back to school. He's just gonna be at camp this summer. They're gonna be outside. But no, get the booster, right? If your child is eligible for booster, go ahead and get the booster shot. Ages 5 to 11 are now eligible for booster shots. And they're still working on doing some testing on children age 4 and under, but we do believe that is coming, right? And that is going to come. They've got to get enough people in the trials. They've got to get the dosage amount right. So it takes a little bit longer. And we're talking about really small children, so they're going to take their time, and I'm okay with that, right? Mm-hmm. So if the rest of us are doing what we need to do,
we'll be protecting them.
We'll be protecting them as we need it. So, Dr. Marks, the floor is yours. You can take us home, wrap us up.
Yeah, I just really appreciate the opportunity, but I cannot say enough. Please get vaccinated. Please get boosted. We need to ensure that you're testing and also taking the right precautions. So the proper hygiene, that didn't go away. When you need to wear your mask, please do so, like Dr. Renee said. But we are here in almost every corner to make sure that we can provide you a vaccine and also testing. Very convenient testing for 3 years and up. And we make it very convenient for you to be able to get vaccinated. So just can't stress that enough. Get boosted, get vaccinated.
Thank you.
It could save life. It could save a life. It literally can save a life. So please get boosted. Please get vaccinated. Go to your local Walgreens, download the app, and then while you're in there, get some other stuff, because they got a lot of things in that store that you can pick up. So just saying, just saying. So check them out. Thank you, Dr. Shauna Marks Wilson. Thank you, Walgreens, for partnering with us, because we really understand that this is a partner relationship between healthcare providers, the end user, and a pharmacist. And so we are bringing on the pharmacist this time to really kind of talk about what it's like. And I'm sure she's probably got some more stories, but we don't have enough time to tell, but I'm sure she's got some more stories that she would love to tell here about some of those interactions. But overall, please keep yourself and your family safe. That's my 3 words. When people ask me, they say, "Oh, you work with Black Doctor. What do you do? What advice?" I say, keep home safe. Those are my 3 words. And the way you do that, however you do that. So we encourage you to get vaccinated. But if you're not getting vaccinated, then what do you need to do? You need to wear that triple mask like Dr. Renee. You need to stay outside. You need to stay from in close places with a lot of people. Whatever you need to do to keep your home safe, because as we've talked about on this show, it is a debilitating illness, and it could have long-term impact on your health. and the health of your loved ones, and you do not want to experience that. So keep home safe, stay safe, and keep watching this because we got more shows going on. So next up, we're going to be having Ricky Fairley and the Touch Breast Cancer Alliance is going to be talking about when we trial. And we're going to be talking about breast cancer trials and how important they are to improving the healthcare outcomes, especially breast cancer outcomes for Black women. So you do not want to miss that. Then after that, we've got the National Black Nurses Association, Pfizer, and 100 Black men, and they're going to be talking about fibroids and breast cancer and mental health. And then finally, we have Dr. Brooks and friends are going to come in. They're going to talk about skincare and hair care. So we got it all for the rest of you. So stick with us. Women's Health Summit here on blackdoctor.org.